Dear student, today we shall discuss another type of meningitis that is known as viral meningitis. So in the previous class we have discussed acute pyogenic bacterial meningitis. So let us try to understand the viral meningitis. As clear from the name that this type of meningitis is caused by various type of viral infection. This meningitis is also known as acute lymphocytic meningitis. Acute because the onset is very much sudden and abrupt. So all clinical manifestation develop in very sudden and abrupt way. So it is acute in nature. Acute onset is very much sudden. Duration is very much short, caused by the viral infection. And lymphocytic, sometimes it is called a lymphocytic meningitis because of the dominancy of the lymphocyte in the affected part of the meninges and in the CSF. So that is why it is called acute lymphocytic meningitis also. It is also known as aseptic meningitis because it is bacteriologically sterile. So in the CSF, because bacterial no evidence of bacterial infection, so it is sterile in nature. So that is why it is called aseptic meningitis. So their different name is given: viral meningitis or aseptic meningitis or acute lymphocytic meningitis. So let us see what are the causative agent of this type of meningitis. Usually this type of meningitis occurs in the early age group, in the child or young adult. Most commonly the virus that involve the leptomeninges causes viral meningitis are enterovirus, ecovirus, coxsackie virus, Epstein-Barr virus, herpes simplex virus, especially type 2, herpes zoster virus, arbovirus, HIV, measles virus, mumps virus, rubella virus, even rabies virus. So these are the different type of viruses that can involve the leptomeninges part of brain and can cause aseptic meningitis or viral meningitis. So the clinical manifestation is very much similar to the acute bacterial meningitis because in this condition also the clinically the patient complain or there is evidence of meningeal irritation and raised intracranial tension. So that lead to the sudden onset of the fever along with headache, along with there is seizure, sometimes there is vomiting, and there is a focal neurological deficit also, convulsion, depressed level of consciousness either in the form of drowsiness or in the form of stupor or even in the form of coma. So all these manifestations that depends upon the severity and duration of the disease because the onset is very much sudden. So all these features develop in the patient in a very sudden way. The patient has got sudden onset of the fever along with the headache, along with the vomiting, along with the neck rigidity and depressed level of consciousness, and sometimes there will be evidence of focal neurological deficit or convulsion or even seizure. So this type of presenting feature generally suspect, and if it is occurs in a very sudden and an abrupt way, we can think about the viral meningitis, but clinically we are unable to differentiate it from the bacterial meningitis because in the bacterial meningitis also and the presentation was similar. So in this type of meningitis the diagnosis will be made again by the CSF finding. So let us see how this meningitis is going to develop. Again, the mode of infection, the route of infection will be same like bacterial infection, that the virus can involve the leptomeninges by either by the direct implantation or by the hematogenous route or by the local extension, but slightly there is a another way of mode of transmission or route of transmission of virus in case of viral meningitis, that some viruses, especially herpes zoster virus and herpes simplex virus and rabies virus has got a very affinity with the nerve. So sometimes the virus can present in the nerve ganglion, especially herpes zoster and simplex virus present in the nerve ganglion, and due to their reactivation, when the immunological alteration or when the immunity of the patient is going to depress, they are going to reactivate, and they can involve the meninges or central nervous system or brain part by the passage through the nerve. So nerve along with the nerve, especially the trigeminal nerve or other nerve, these viruses can involve the leptomeninges or brain parenchyma and may lead to the development of aseptic or viral meningitis. Sometimes the viral meningeal involvement may extend and involve the brain parenchyma. So brain parenchyma may undergo inflammation, acute inflammation. So this lead to the development of another disease, another medical emergency disease and complication of viral meningitis in the form of encephalitis. So from the meninges, this virus can involve the brain parenchyma, and the brain parenchyma undergo acute inflammatory changes, and that lead to the encephalitis. So a viral meningitis can manifest in the form of encephalitis when the brain parenchyma is going to involve. So this is the usual way of progression of disease of viral meningitis. So by the different route, either from the local extension or by the direct implantation or the hematogenous route or through the nerve fiber, these viruses can go to the leptomeningeal part of the brain, and here it lodges and initiate the acute inflammatory reaction in the form of congestion, edema, or in the cellular changes, vascular changes. That all changes are very occurs in acute form. In the acute inflammatory reaction is going to seen here. So affected part of the brain or meninges undergo changes of acute inflammation, like they are going to swollen, they are edematous, there will be congestion, the blood vessels are dilated, and microscopically there will be evidence of infiltration of large number of lymphocytes. So in the viral meningitis, it differs from the bacterial meningitis. In bacterial meningitis, what was going to happen? Here there was infiltration of large number of acute inflammatory cells in the form of neutrophil in case of bacterial meningitis, but here in the viral meningitis there will be evidence of large number of lymphocytes are dominantly seen in the affected part of the brain, in the leptomeninges or in the brain parenchyma. So this is the basic difference between the acute bacterial meningitis and viral meningitis, or even from encephalitis also. But the differential diagnosis and confirmation of aseptic meningitis or viral meningitis or even encephalitis will be again made by CSF finding. So CSF finding will be only tool or criteria for the differentiation of viral meningitis along with encephalitis from acute bacterial meningitis. एक ही रास्ता है दोनों को अलग करने का, किसको बैक्टीरियल मेनिंजाइटिस को और वायरल मेनिंजाइटिस को, और इवन इनकेफ्लाइटिस को। जो इनकेफ्लाइटिस जो कि वायरल मेनिंजाइटिस के चलते होता है या ड्यू टू द डायरेक्ट इन्वॉल्वमेंट ऑफ ब्रेन पैरेन्काइमा बाय द वायरल इन्फेक्शन, in case of encephalitis they are differentiated by only one criteria, only on basis, that will be the CSF finding. So CSF finding will be the only investigation of choice that differentiate, that confirm the viral meningitis and encephalitis, viral encephalitis, and from acute bacterial meningitis. So acute bacterial meningitis से viral meningitis को और encephalitis को हम लोग CSF के द्वारा ही differentiate कर सकते हैं. So let us try to understand and see that what are the changes in the CSF in case of viral meningitis along with the viral encephalitis also, या meningoencephalitis जिसको हम लोग बोल सकते हैं, that differs from acute bacterial meningitis in this way. कौन कौन सा तरीका होगा? So again we take the CSF. If you suspect the viral meningitis, we take the CSF, we obtain the CSF and try to investigate the CSF picture in different heading. So if you go for the physical examination of obtained CSF, you will find that the CSF is clearly and slightly turbid. So it is a very important difference. Recall the previous CSF finding in case of acute bacterial meningitis, where the CSF was turbid and hazy and it is cloudy in appearance. But here in case of viral encephalitis or aseptic meningitis, the CSF will be clear, watery, just transparent, slightly turbid. So this is the finding that you can see by the naked eye and can conclude or think that this type of meningitis is nothing but it may be a case of viral meningitis or it may be a case of viral encephalitis. But it is not sufficient. We proceed forward and go for the cytological examination. So in first chemical examination. So in the chemical examination, again we see protein and sugar level. In case of viral meningitis, if the patient has got viral meningitis, the protein level will be slightly elevated or it remains normal. Usually it is more than 250 mm water. So protein is elevated, but it is not so markedly than bacterial meningitis where the protein elevation was very markable, or it may be remain normal also. So far the sugar is concerned, as you know that in case of bacterial meningitis the sugar level is drastically decreased, but here in case of viral meningitis or encephalitis the sugar level will be remain within normal limit. So this is a very important difference between two, that the sugar level is very much decreased in case of bacterial meningitis, but here the sugar level remains within normal limit because the virus does not utilize sugar for their growth or for their culture. So this is the chemical difference, and the pressure will be also elevated in case of viral meningitis. It is very much elevated because of the meningeal irritation and raised intracranial tension. So pressure will be raised like bacterial meningitis. So pressure will be elevated in both conditions, but protein and sugar is slightly different. That protein is slightly either remains normal or slightly increased, and sugar remains within the normal limit in case of viral meningitis in contrast to acute bacterial meningitis. But if it is not sufficient for the confirmation of diagnosis or differentiation of diagnosis, we go for the cytological examination. And the cytological examination will be give the 100% picture that if the patient has got aseptic meningitis or encephalitis, the CSF will show large number of lymphocytes. So this is a very important difference between two. Only one criteria for differentiation of CSF finding from acute bacterial meningitis, that in case of acute bacterial meningitis what was happen, there will be dominancy of leukocyte, especially neutrophil. But here in case of viral meningitis it will be there will be dominancy of lymphocytes. So this is a very important difference between two, acute bacterial meningitis and viral meningitis. The CSF picture will be like this. And if you go for the microbiological examination, if the patient is suffering from aseptic meningitis or viral meningitis or encephalitis, the CSF will be sterile. So there will be no evidence of bacterial growth or no evidence of bacteria. So that is why it is sterile. So that is also it is called aseptic meningitis, because bacteriologically it is negative or sterile. So these are the criteria of different CSF findings that help in the diagnosis of aseptic meningitis or viral meningitis or even encephalitis, and it is also helpful in differentiating meningitis, viral meningitis from acute bacterial meningitis. You must know, because it is very important in the day-to-day practice. Very confusion is going to occurs to the clinician or pediatrician to decide that whether the meningitis is bacterial in origin or whether it is viral in origin or whether the patient has got encephalitis. So only by the CSF finding we are certainly able to differentiate between three conditions: bacterial, viral and encephalitis. Viral meningitis और encephalitis का CSF पिक्चर लगभग सेम रहेगा, लेकिन बैक्टीरियल से ये डिफर करेगा। बैक्टीरियल में जहाँ पर लिम्फोसाइट न्यूट्रोफिल डोमिनेंट था, यहाँ पर लिम्फोसाइट डोमिनेंट रहेगा। सो दीज आर द फाइंडिंग्स बाय विच वी आर एबल टू डिफरेंशिएट द viral meningitis from bacterial meningitis or other type of meningitis like chronic meningitis, tuberculous meningitis. That will be that finding will be certainly help for the diagnosis as well as differential diagnosis, because on the clinical ground we are not going to differentiate बैक्टीरियल होगा या वायरल होगा या एन्केफेलाइटिस होगा। केवल क्लिनिकल ग्राउंड पर हम लोग नहीं डिफ्रेंशिएट कर सकते हैं, बिकॉज इन ऑल दिस कंडीशन द प्रेजेंटेशन इज वेरी मच सिमिलर, दैट देयर विल सडन ऑनसेट ऑफ हेडेक फॉलोड बाय फीवर, फॉलोड बाय नेक रिजिडिटी, फॉलोड बाय वोमिटिंग, followed by alerted stage of consciousness, followed by the neurological focal neurological deficit, along with the convulsion, coma. So the all sign and symptom will be same in case of bacterial, viral or encephalitis. So only criteria will be the CSF finding, the picture, and you must know throughout the life, because it is very much essential for not only diagnosis but also differential diagnosis. So this is the CSF, usual CSF picture in case of viral meningitis as well as encephalitis. Usually if you go for the microscopic examination, will be find that the affected part of leptomeninges is swollen, edematous and congested. The brain parenchyma, if it is going to affect the, it also has got swollen if the encephalitis is developed, or sometime there will be evidence of acute inflammatory changes. So in the microscope you will find there will be infiltration of lymphocyte in the affected part of the brain parenchyma in the leptomeninges. So sometime there will be new vascularization. If the disease is going to progress, so there may be chance of gliosis or blood vessel may be thrombosed. So these are the findings that can be seen in the affected part of the brain, in the brain parenchyma or in the leptomeninges. So this is the microscopic picture we just we can see. So far the complication is concerned, the viral meningitis is, all of you know that it is due to the viral infection. So generally it is self-limiting disease, meningitis, because it is caused by the virus. So no drugs are quite effective against the replication or development or progression of the disease. It is usually self-limiting, so patient may recover spontaneously. As the time passes, immunity is going to develop against the viral infection and your patient may recover spontaneously. Only conservative treatment and supportive treatment is given and waiting for the development of immunity against the viral infection, so that your patient can spontaneously recover. So this type of meningitis is self-limiting, but you know that in case of bacterial meningitis, it is not self-limiting, it is almost always medical emergency. You must start the proper antibiotic in proper dose in very rapid and very methodical way, so that the complications should not develop, because if the bacterial meningitis may lead to the development of a complication like brain abscess, like a coma, like even there may be chance of hemorrhage and there may be chance of death also. So in case of viral meningitis, the progression is although it is abrupt onset, but the disease is self-limiting and there may more chance of spontaneous recovery in case of aseptic or viral meningitis or even encephalitis. Only supportive treatment is given till the immunity is going to develop. So these are the usual presentation, usual clinical features and usual CSF finding in case of viral meningitis or in case of encephalitis. Viral meningitis, as you know that it is self-limiting, so as the disease following after the infection, it may recover, but if it persists for long duration, the infection can extend, and from the meninges it can involve the brain in the form of encephalitis. So encephalitis is the main complication that can be seen in case of viral meningitis. सो इनकेफ्लाइटिस ही ज़्यादातर होने का खतरा रहता है इन केस ऑफ वायरल मेनिंजाइटिस, नहीं तो और कोई विशेष कॉम्प्लिकेशन नहीं होता है. फिर भी देयर मे बी चांस ऑफ फोकल न्यूरोलॉजिकल डिफिसिट और सीजर और कन्वल्सन और कोमा, दे कैन बी हैपन in case of aseptic meningitis. So these are the some complication of viral meningitis. So this is all about the viral meningitis. You know the causative agent, you know the mode of transmission, you know the gross findings in the affected part of the brain and brain parenchyma or leptomeninges. You know the microscopic finding. The only finding will be what? There will be infiltration of lymphocytes in the affected part of the brain and meninges. And you know the most important aspect of meningitis, and that will be the CSF finding. So you, by noting the CSF finding, by noting the clinical finding, by noting the signs and symptoms, certainly we are able to confirm the diagnosis. But in some time CT scan may be required to know the exact location of inflammation or changes in the affected part of the brain. So for the localization or for the noting the further complication, you may go for the radiological examination like CT scan. But by the clinical feature as well as the CSF finding, it is 100% diagnosed, and certainly we are able to differentiate it from the other type of meningitis like tuberculous meningitis, acute bacterial meningitis, from brain abscess, even all the type of encephalopathy. The CSF finding is the only investigation that help in diagnosis, confirmation of diagnosis, as well as differentiation of meningitis from the similar condition where there is evidence of meningeal irritation or raised intracranial tension. So these are the things about the viral meningitis as well as viral encephalitis. In the next class we shall study the chronic meningitis, especially the tuberculous meningitis will be discussed in the next class. Till thank you.